Hello, everyone, and welcome to the live. My name is Dr. Reg Omangi. I am a medical doctor licensed in the Republic of Kenya, working at HealthX Africa, and I am with.
My name is Christine, a clinical nutritionist registered by KNDI. Welcome to the live session.
Welcome, everyone. So, as we had spoke earlier, today we're going to talk about hypertension. So what is hypertension? Hypertension is simply high blood pressure. Why is this important? High blood pressure or hypertension is one of the leading causes of death. When it comes to hypertensive related deaths, hypertension tends to lead when it comes to the number of mortalities that we have in the country. So it is very important that we are educated on hypertension, what it is, how it comes about, how best to prevent it, and how to manage it if we do have it. So we can begin. And another danger when it comes to hypertension is that it is a silent killer. That is a problem. It's the biggest issue when it comes to hypertension. Hypertension is silent because the problem when it comes to what it does to our bodies isn't even the high blood pressure. It is the complications of that high blood pressure on our organs. So first of all, what is hypertension? Hypertension, as we said, is simply high blood pressure. It is high blood pressure. So blood pressure is measured against two figures or two parameters. When we've all had our blood pressure taken, we've seen that there are two numbers. So the top number is the systolic blood pressure. The bottom number is the diastolic blood pressure. So what does this mean? So the systolic blood pressure is the blood pressure when the heart beats, because the heart beats, relaxes. There are two beats, pop, pop, lub, dub, lub, dub, lub, dub. So when it comes to the systolic high blood pressure, which is the bigger figure, that is the blood pressure exerted on our vessels when the heart is pumping. That is the highest blood pressure figure. And the second figure down, which is the diastolic. Diastolic means the phase of heart relaxation. That is the blood pressure when the heart is relaxed. So the ideal blood pressure or optimal blood pressure would be below 120/80. Not too much. If it goes below 100, that we call hypotension, which is low blood pressure. But anything below 120/80 is optimal. And normal blood pressure would range between 120 to 129 systolic or 80 to 89 systolic. Anything above 129 in the 130s, we're starting to get into hypertension, where we're looking at the different grades of hypertension. There's pre-hypertension, which is 130 to 139. There's grade 1 hypertension, which is 140 to 149 systolic. Grade 2, 150 to 160, and so forth, up to grade 3, which is above that 160 figure. So it is very important that we constantly measure high blood pressure, our pressure, to make sure we do not have high blood pressure, because we wouldn't know. We do not have the ability to tell our blood pressure just from feel. And when we're already starting to get symptoms that would be caused by high blood pressure, it means that the organs affected by high blood pressure are already starting to show some damage. So it is very important to constantly monitor. It is the best way to keep track and prevent any severe case of hypertension-related mortalities or morbidities. So how does hypertension come about? There are two types. There is primary hypertension or essential hypertension and secondary hypertension. So primary hypertension is hypertension that just your blood pressure just goes up because of an unidentified cause. So it just happens. It could be because of lifestyle diseases or lifestyle choices or sedentary lifestyle, but most of us tend to have primary hypertension. Secondary hypertension is blood pressure caused by other disease processes in the body. So let's say if we have kidney failure, that might tend to lead you towards hypertension. If there is a tumor in your body producing hormones like adrenaline or these catecholamines, which tend to raise blood pressure, that would cause hypertension. That would be secondary hypertension. So secondary hypertension is high blood pressure caused by another disease process in the body. So now we can move into the causes of hypertension that we know. The most common cause, and that's where my colleague will come in, is nutrition and lifestyle. She can correct me if I am wrong, but nutrition and lifestyle is the biggest cause of hypertension in our country. Another, as I was saying, is other disease processes. Could be a tumor producing some various hormones, could be some other organs are failing due to other disease processes like liver failure or kidney failure. And another big reason, we call it in the medical field idiopathic, which means we do not know. Joke that we have is because we are idiots and we do not know, so we deem it idiopathic causes. So when it comes to diet and exercise, I will let my partner today try to elaborate on that. So, Christine, what do we mean by a bad diet would cause hypertension? Give us some guidance on that.
All right. So the way Dr. Rija has explained about hypertension, he has mentioned something called pre-hypertension. This is a time where there are indications that you are likely to develop hypertension. So one of the things we look at is how is your weight? How is your weight before and now? Because in most instances, when you look at the development of hypertension, one of the contributors will be you gained excessive weight because you are leading also a sedentary lifestyle where you're not able to exercise and you're not very cautious or rather intentional of what you're eating. And there's one thing we call the waist hip ratio. This is where we measure your tiniest part of the waist and your widest part of the hip and divide it. So when for men, the reading should be below 0.90 centimeters, and for females, it should be below 0.85 centimeters. So when you already do that and notice that you are above those parameters, it's already an indication that you are likely to develop lifestyle conditions, one of them being hypertension. So we look at what are you ordering on your plate. So in the management of hypertension, one of the things we look is the amount of sodium you're consuming. And how would you know that? Sodium is applicable in our daily cookings, like what you use in the salts, and also the foods that we're able to buy from the stores. You have to be very intentional about the labels. So you need to know, first of all, processed foods, for them to have an extended shelf life, they'll be preserved with sodium. So one of the things we do when you're going to buy, make sure that you're reading, if I'm consuming this amount, because the nutritional labels will be indicated. Just know if I'm consuming this much, this is the amount of sodium I'm taking in. So that then you make a choice, like you're very intentional of the things you're purchasing, meaning you will go for fresh foods.
Fresh food.
And as a country, I believe we are positions where we are able to access fresh foods from our markets. So I wouldn't debate if you're able to get fresh beans as opposed to going to buy something like a canned bean, because you'll find they are preserved with sodium, meaning even before cooking them, you need to rinse it out, which indicates then you can, in the process of rinsing out, you're also losing some nutrients. So in the management of hypertension, we advocate for fresh foods. And then we have what we call the DASH diet, which is dietary approaches to stop hypertension. And this particular diet emphasizes more on consuming more of vegetables and fruits, and also consuming very low to fat-free dairy products, and also limiting your consumption of what we call the saturated fats and the trans fats. So saturated fats, mostly you'll find them in full cream dairy, you'll find them in the red meat, meaning then when you are going to buy your protein, especially the proteins, ensure they're very lean. So you can opt to go for something like fish, you can go for chicken, and if you're going for the red meat, let it be once, and also go for the cuts that are very lean. Yeah.
Okay, so you've mentioned fatty diets. So what would be the link? Maybe you could explain to our audience. What is the link between a high fatty diet and high blood pressure specifically?
All right. So what you'll notice in the management of hypertension, there's a likelihood to have an increased level of cholesterol. And where are we getting this cholesterol? It's from the saturated fats and the trans fats, meaning that they're going to clog your arteries, which predisposes you to now something like a stroke. And you've already mentioned for hypertension, you do not have symptoms. It's a silent killer. So it's one morning you're not, your left side is not working. That's when you know probably now I've suffered the consequences because I was not very keen in monitoring blood pressure. Yeah.
Okay, so when you said with the fatty diets, when you have an increased fatty diet, especially with the saturated fats, yes, so you would tend to have high cholesterol levels, and these cholesterol levels would when cholesterol is high in the body, it would tend to deposit itself on the arterial walls,
Exactly.
thus reducing the space inside the arterial wall. So typically, it's the same concept as with the hose pipes that we use at home.
Yeah.
The thinner it is, the higher the pressure. So essentially, now your heart has to pump through this smaller space. So that would, in your opinion, that would now increase the likelihood of high blood pressure because your heart is having to pump a lot more.
Yeah.
Okay. So when it comes to canned foods, so someone would say the food isn't salty, yet there is sodium.
Exactly.
So as they try and salt it, so they'll be having a lot more sodium in their diet, which tends to spike the pressure.
As they're trying to rinse it out, or
Let's say now if I tend to eat a lot of canned foods or processed foods,
yeah,
so even me adding salt to that makes it even worse.
exactly. And getting sodium is from simple things as even the condiments that we use at home. So I would advise you can flavor your food using more of herbs and spices like garlic. You can use rosemary. You can use ginger. You can use lemon as part of your flavoring. And also now ensuring that you're adding foods that are very rich in potassium, so that potassium is able to flush out the sodium in the foods as well. Yeah.
Okay, so when it comes to what are some of the foods rich in potassium, I'm sure people would want to know.
Yeah, we have things like avocado, we have the banana. So this could be green banana or the ripe banana. We have dried fruits like raisins.
Yes.
We have sweet potatoes. We have orange juice. This is a freshly squeezed.
Freshly squeezed,
yeah.
not bottled orange juice.
Yeah, so those are some of the foods that can be incorporated because it's very well documented that when you increase your potassium intake, it can lower your blood pressure. And research that has shown anyone who is a very good reader can,
Yes,
read
yes.
more about it. Yeah, so we should incorporate those foods in our diets.
And you also mentioned the impact on weight. Weight and the waist to hip ratio. So how has that been shown to increase the likelihood of blood pressure?
So, on the waist area, we have what we call the visceral fat. This is fat that is supposed to cushion vital organs. But there are measures, normal ranges that one should be, especially if you come now to our facility, we are able to do do the body composition analysis, and then you can know if your visceral part is, within the normal ranges. So in that category, if the visceral part is exceeding the normal ranges, then predisposes you to, because you'll find most of the time, if you look at the readings, you'll find such a person is someone who is quite inactive. So you'll find mostly the work involves around a desk job. You also find maybe if you have an injury that does not allow you to work out, then you are meant to sit all the time. You are also likely to gain weight and also gain weight around your abdominal area, which then in this scenario poses the risk of hypertension, the way you are putting it, or the risk of increasing again your cholesterol levels. Yeah.
So in this case, you'd find the diet might, so the combination of a bad diet and not having enough exercise adds on to, piles on to the high blood pressure, the risk, it piles on to the risk of suffering from high blood pressure and the consequences that come after.
Yeah, true.
Okay. Well, something that we need to talk about hypertension is what are the effects that it tends to have on the human body. So when it comes to hypertension, as we mentioned earlier, that it is a silent killer. And the thing about hypertension is it affects every and any organ of the body except our hair, nails, and teeth. So if we are to start with the effects of high blood pressure, top to bottom, there are different ways high blood pressure affects the human body. One would be one of the most important organ in our body is our brain. As my colleague had said earlier, that it would predispose you to the risk of a stroke. So first, that will be a story for another day, but what is a stroke? So a stroke is the stoppage of blood flow to a part of the brain. And this, as she said, is cholesterol tends to deposit itself on the arterial walls. And as the arterial lumen, which is the space inside the wall, gets smaller and smaller, these deposits they keep growing, and some of the pieces of these deposits may break off, either clot formed or the plaque itself breaks off and travels throughout the body and lodges itself in even smaller blood vessels in our brains, stopping blood flow to that side of the brain. And that's why you'd find with stroke, you tend to see some people who are paralyzed waist down or paralyzed on one half of the body. That is a very serious consequence of high blood pressure, which is now stroke. That's from the brain part. We all have heard of stroke and how serious it is, but it is mostly a consequence of high blood pressure and all the other chronic illnesses like diabetes. Another would be moving to the eyes. There is a condition we call hypertensive retinopathy, which is damage and inflammation to the retinas caused by high blood pressure. So you can get microaneurysms in your retina. Your retina, in severe cases, might detach from the wall of the sclera, which is the body of the eye, which would now lead to vision loss. Hypertensive retinopathy is quite a wide topic, and in some severe cases, it can lead to sudden vision loss or progressive vision loss. When we move down to the chest, we have two very important organs, the lungs and the heart. Mostly high blood pressure tends to affect the heart quite a bit because, as we mentioned earlier, the heart is having to work harder to pump blood against the blood pressure, against these small arterial walls. So they are hypertensive cardiomyopathies that may show up, which the consequence of that is heart failure. So sometimes as the muscle of the heart, because the heart is a muscle, as it's trying to pump against an increased resistance, it might thicken. And this thickening may cause, so the heart tries to grow to overcome this force, and it tends to sabotage itself by thickening so much that the space inside uh, the heart chambers becomes too small for enough blood to go through the body. And this is a condition we call heart failure, which is, there are many different types. So a lot of the time we tend to see heart failure with reduced ejection fraction, which is the amount of blood that is pumped out of the body. And another consequence of high blood pressure, it would affect your lungs as well, mostly by cases of pulmonary emboli, which emboli are small pieces, could be a clot or a plaque of a cholesterol deposit plaque that may travel, as we were speaking about stroke. It may also travel to the vessels of the lungs and block blood flow to that side of the lung, which now we all know the lungs are there to facilitate oxygen delivery, to facilitate gaseous exchange between the oxygen we breathe in and the carbon dioxide we breathe out. So breathing may become an issue, and not being able to adequately oxygenate your blood may lead to other organs failing. And when we come back to the heart, one of the most common hypertensive related mortalities are caused by myocardial infarctions or heart attacks, as we call it. So a heart attack is the same plaque forming around because the heart is still a muscle, it's an organ that also needs oxygen. So the heart has its own blood supply to facilitate oxygenation and pumping. So some of these blood vessels that supply the muscle of the heart might get progressively clogged, and eventually a plaque may block it entirely, leading to that side of the heart dying, which is now myocardial infarction or now heart attack. And some of the symptoms of heart attack are severe chest pain, feeling tightness or heaviness in the chest. It's a very severe pain that sometimes radiates to the left side, mostly of the left shoulder, the left arm. Sometimes it may go up the neck on the left side. So these are red flags that if you have these symptoms, it may mean you have a heart attack or a myocardial infarction, and it would need urgent medical care. So this is a very serious comorbidity or very serious modality of mortality per se when it comes to hypertension. Another very common consequence of hypertension in our country is hypertensive nephropathy, nephropathy, which is damage to the kidneys. The kidneys are very vital for human life. We have two. And these kidneys, our kidneys need a lot of blood supply to be able to filter out blood, to be able to excrete all the waste products that we produce. And the kidneys are very dependent on blood flow. So when it comes to the cardiac output of the heart, as the heart is supplying blood to the entire body, our kidneys need 25% of the heart's output to actually function properly. So in your entire body, as blood is going through your body, 25% of it has to pass through your kidneys at any given time. That is the cardiac output they need to properly function. So when it comes to high blood pressure, it tends to damage the small nephrons inside the kidneys, leading them not to function as properly, which may lead to further high blood pressure or now kidney failure, because the kidney has various roles that it works on aside from excretion. It does a lot of function when it comes to blood pressure control even. So sometimes when it comes to kidney failure and hypertension, it can become the case of the chicken and the egg, where hypertension can lead to kidney failure and kidney failure can lead to hypertension. So these two diseases are very much linked and needs to be very, very, it needs us to understand and take care of ourselves and ensure that we try and mitigate the risk of us having these complications of high blood pressure per se, because those are the killers. And now when it comes to treatment, we've talked about what high blood pressure tends to do. And even another bit I didn't mention is it tends to also damage our nerves as well, every single nerve, especially when it comes to the extremities. Diabetes and hypertension specifically tend to also cause damage to our nerves. We call it hypertensive neuropathy. But we've already talked about the scary bits of hypertension and what it does, especially in the worst case scenarios later down in line. And all these things happen slowly. They rarely happen all of a sudden. So you've had high blood pressure for a long time, and these symptoms, these processes happen slowly. So by the time you're having the symptoms of stroke, of heart disease, of heart attack, unfortunately, it means that you've had a long-standing chronic illness, that is hypertension and other chronic diseases that are linked to hypertension. So it is very important, it is imperative that we constantly monitor our blood pressure and constantly work on preventing blood pressure. So first, we will talk about the management of blood pressure before we lead to how do we prevent it. So one, there are two important modalities. So I will talk about the medical side and the non-medical side. These two aspects you cannot manage one and leave out the other. And that's why my partner is here to talk about the non-medical side. So the two most important ways to manage high blood pressure is one, being on medication. If you are on medication, we need to be very consistent. And the other part is the diet, the lifestyle modifications, if I'm to summarize. So the diet and exercise, and I'll have her speak on that. But I will first speak on the medication. So there are many different types of drug classes when it comes to hypertension that deal with hypertension in two various aspects. So blood pressure is an equation of how cardiac output. I wish I had a whiteboard. I would be able to explain and draw all these things. But blood pressure is an equation of the cardiac output, how much your heart is pumping out per minute, versus times, it is that multiplied by vascular resistance. So if you increase the cardiac output, either by your heart rate or your heart pumping more blood, your blood pressure will go up. But now when it comes to the vascular resistance, it means now, when we were talking earlier, how much resistance your vessels are offering. If they are big and dilated and they are of adequate width per se, you tend not to have high blood pressure, as blood is flowing freely. Blood is a fluid. It flows freely the bigger the diameter of the vessel. The smaller the vessel, or the smaller the space, that tends to increase the resistance, which now increases the blood pressure. So even the medications that we do give our patients, either in combination or singular medication, they tend to affect either the cardiac output or the vascular resistance. So we tend to have very different classes, some being beta blockers. So we have 5 classes of drugs. So we have beta blockers, which tend to affect centrally the blood pressure, so from the heart and the vessels, and the control of the dilation. We tend to have calcium channel blockers, which affect vascular resistance and how hard the heart contracts specifically. So calcium channel blockers tend to do that. We have ACE inhibitors, which are angiotensin receptor inhibitors and angiotensin receptor blockers. These tend to now affect, as I had mentioned earlier, the kidney. The kidney has a role in controlling blood pressure. So these two classes of drugs tend to address that. They tend to address how big your vessels are. So these medications are very important. They help your body control blood pressure when your body is unable to do the same. And all these medications need to be taken consistently at the same time every day. So if we give you a medication and it's once a day, we make sure we take it once a day, every day. We do not stop. A big mistake our patients tend to make is they'll start medication for 1-2 months. I'm sure you've seen that in your practice. 1-2 months, then they measure their blood pressure, they see, oh, it's back to normal, and they decide to stop the medication. And I tend to advise patients that we do not stop unless a medical professional that you have seen advises you that now we can stop. When you're on blood pressure medication and your pressure is within the normal range, it means the drug is working. It means we do not stop medication. Once we stop medication, the blood pressure spikes back up and we're back to where we were. So we need to make sure we are taking our medication consistently. We need to be adherent, because one of the biggest mistakes our patients make is not being consistent with medication. And even that way, we cannot know for sure if it's the medication that's working or you're the one that's not really taking medication properly. So that is one arm of hypertension management. It is the pharmacological side, which is the clinical side where we give medication. And now the other most important, if not more so than the pharmacological management, is now the lifestyle modifications. And I'll have my colleague now guide us more through that, because that is arguably, it goes hand in hand with medication, but some studies show it's even more important than medication. So kindly give us some clarity on that.
Thank you so much, Dr. Riju, for taking us through the medical side. So when it comes to management through diet, one of the things we want to look at is how can we, if you're, let's say, overweight, how can we reduce your weight? Because it's been proven that if you reduce at least 10% of your total body weight, even the blood pressure comes down. So losing weight is one of the areas we consider. And also, if you're managing blood pressure and you know you're not overweight, one of the things we can look at, how actively are you? Are you saying, because I'm very tiny, I don't need to exercise? So exercise is very paramount, and you really don't have to enroll in a gym. I'm happy that technology is here to help us. So meaning there are exercises you can actually do in the house through the help of YouTube. If also you work somewhere where, let's say, for example, you're using an elevator, you can take the stairs. If you're driving, at times you can park away from, your office and walk a little. If you're using a matatu and you're going back home, you can actually highlight a stage that is before yours, as long as it's safer, then walk. Because what is recommended is just an exercise of consistently walking for at least 30 to 45 minutes for 4 to 5 days a week consistently. And also, if you're someone who sits for very long hours, you can stand in between work, you can have your printer away from your desk. So let us move, basically. Let us not just be seated for long hours. So exercise and also working towards losing your weight are very key. And also now we look at what is on your plate. Because I've said in the management of hypertension, we are looking at what we call the DASH diet, which emphasizes more on fruits and vegetables and lean proteins and low saturated fats and trans fats that are very limited. So what this means then, you do not wait to have your vegetables only at lunchtime or at dinner, because then you will have not reached the recommended servings per day. Meaning then we can start having our vegetables very early in the morning. And when I talk about vegetables, I'm talking about the non-starch vegetables, meaning they're not offering really starch, and if they're offering, it's very minimal. So this is our leafy vegetables. We're talking about cabbage, spinach, sukuma wiki, kienyeji vegetables. We're also talking things like capsicum, the hohos, the danias. So those are our vegetables, and we should see a shift where you're able to have a balanced meal during your breakfast, whereby on that healthy plate, 50% of it should be the non-starch vegetables, so that they fill you up. And then the other part that has remained, the quarter, we can have the lean protein that we talked about. And then we need to have our whole complex carbohydrates, meaning that they're minimally processed. And this also helps you if you're having your protein even in the morning, the fast, when you're breaking your fast. So breaking your fast could be probably at 8, for someone it could be at 10. By incorporating a protein means you're able to experience the satiety value. The veggies are also helping you digest slowly. Therefore, you do not have the cravings, or rather the hunger pangs that come in between, that are leading you now to crave the sugary foods, because sugary foods are equally damaging, like the sodium that we're talking about when it comes to managing hypertension. And also now we look at the work-life balance. I know we cannot avoid stress, but we know if you are not able, let's say, to sleep well, in this case, I'm talking about sleep quality as opposed to just quantity. If you're consistently sleeping below 6 hours every day, then it means your hormones are not well regulated, especially the hunger hormones, the cortisol hormone in this case. Therefore, balancing, ensuring that you're able to balance out, work, home life, and you're able to sleep better, can also be one of the ways you are able to manage your weight, because then your hormones are well regulated and you're not stress eating or craving the sugary foods that I'm talking about. So that would be one area we look at: sleep and also regulating your stress, basically. And also now there is what we call hydration. Hydration in this case, we could talk 6 to 8 cups of water. However, it differs on where you live, the work you do, the weather that is out here, because if it's extremely hot, then we could be talking about 6 cups and they're very minimal. What I'm saying is, can we learn to hydrate, because water even quenches our food cravings.
Yes.
So ensure you are having at least 8 cups.
8 cups per day.
Per day of water. And also you can, even in scenarios where you want to hydrate and you are craving something like, let's say, soda, you can alternate and have even soup as part of hydration. Yeah, these are some of the things you can do to walk away from the sugary intake. And also, when it comes to blood pressure, it is okay to occasionally walk into even the nearest local pharmacy at your place and check your blood pressure. You do not really have to wait until when you go in for your hospital visit to now be measured. These are initiatives you can take into your own hands. And also another thing is now to be very cautious on food labels. Read things that are on the shelf before purchasing them. And we know processed foods like now bacon, sausages, they're very high in sodium. And we also know foods, especially those are packaged in do I call them like air, for them to have a longer shelf life. So they'll have sodium as a part of preservation. So food labels are very, very, very
important.
key. Yeah, and then also ensuring that you're having your meals early enough so that you can increase your movement. For instance, if you're able to eat early, let's say by 6, by 5, by 7, depending when you get home, you can have 30 minutes of walking before going back to the house, to continue preparing for your next day. Yeah.
Okay. So it's about taking those small intentional steps or decisions throughout your day.
Yeah.
Try and make them, at least when it comes to increasing your step count, as you've said, park far away, eat early so that you're able to move. Okay. And in your expert opinion, when it comes to sugary foods or drinks, what's your opinion on the people tend to show concern over the sugar-free sodas or the zero sugar sodas? What's your expert nutritionist opinion on that?
On the sugar-free, what you need to know, first of all, you need to know when you're consuming carbonated drinks, you're also predisposing yourself to things like osteoporosis because they tend to weaken your bones. So in as much as it's written 0, we've not now, because that is more like a marketing strategy, we've not now dived further and look at, yes, it's written 0 sugar, but it is a carbonated drink. What other ingredients have they used that is not recommended for consumption, especially if I'm very keen on wanting to, maintain my bone health. So we cannot just look at one element that this product is written. It's in the same case when you're going to buy even something from the store that is written low fat. At times when you're also looking at low fat, you need to know, are there added sugar? So that is why I'm saying be very intentional when you're purchasing anything that is processed outside the house, because that is where all the hidden truth
is.
Yeah.
So your advice to everyone is read the label.
Yeah.
Make sure you read the back of the label, not just the marketing bit.
Yeah.
Okay. So I think my colleague is right in the fact that we should be very careful of what we take. We should be proactive in watching what we eat and looking at the labels of the products of the things we buy. Being wary of our sodium levels, especially if you are a known hypertensive or if you've had any history of high blood pressure, it is important that we be aware and cognizant of what we are taking in our bodies. And that is now the management of hypertension on your side. But what would be your advice for prevention? Now, when we talk about prevention of hypertension, when it comes to the lifestyle modifications, is it similar? What's different now? Let's say someone like me in their 30s, I have no history of hypertension in my family, but I just want to prevent it for as long as possible. What advice would you give?
All right, for anyone already diagnosed with hypertension and someone who does not want to develop, the management is more similar. It's more the same. However, now for someone who has not developed the hypertension, one of the things you can do is ensuring that you're having more homemade meals, because then on homemade meals you have more control on how the food is cooked, the type, the amount of oil that is being used, the spicing bit of it. Especially I know things like the soy sauces will have more of the sodium in it. So meaning that when you're able to have more of your homemade meals, then you are in control. So that would be one of the things to look at. If you are not really active, this is the time now to be, in terms of physical exercise, this is now the time to develop something that is simple to follow, so that there's that consistency and you're able to look forward to, exercising for yourself. And then also you can also look at buying more from the market in bulky, so that you have prepared your meals for the next couple of days, so that when it gets to, let's say, around midweek and you run out of your stock, you're likely to order from outside. So one of the things you can do is just buying in bulk and prepping this food, so that even when you get home tired, you're still able to get a homemade meal. So those are the things you can look at. And also if you're taking alcohol, if you're smoking, because these habits you're doing as someone who is very young will definitely reflect in a few years to come. So one of the things you want to do is to limit your alcohol intake or even quit. And then the smoking also, you can begin teaching yourself how to come out of it, because this is one of the ways you're able to manage, to keep off from developing things like hypertension, the way we are saying. And also another thing you can do is make water your friend. You've noticed, you've taken us through how these diseases are more like sisters or cousins, I would call them.
Yes.
So meaning if your kidneys are not filtering well, your heart is affected. So make water your friend. That's why you'll see every time you're calling a doctor, the first thing they tell you, please hydrate.
Have you taken any water?
Yeah, hydrate and prioritize sleep is very key, so that hormones are well regulated, and also now manage the stress in our life, basically.
Okay.
Yeah.
It's very insightful. And one last question. I will talk on my perspective when it comes to managing patients with hypertension. From the medical standpoint, the biggest challenge I see with patients is drug adherence. On my side, when I'm managing hypertensive patients, the biggest problem is they're not consistently taking their medication, which tends to be a big issue in terms of blood pressure control. So my question is, from your perspective, what's the biggest challenge you get when managing patients from the patient side?
So on my end, when I'm managing patients and we are trying to modify their foods, for example, I'll look at what kind of work do you do, so that we ensure that your energy input equals your energy output. So when I come and tell a patient, now give me your diet history, what are you taking, how are you serving, how are your portions, and now when I take them through and say what we're going to do on your plate, we are gonna have of it, have the vegetables. The first thing they ask you is, will I get full? It's already engraved in them that this is very little and I won't get full. So the challenges I experience, especially during the very first consult, is how will I move to wanting to eat this particular food every day and in this amount to just such a small serving. But then we work around the portion control, the kind of plate they're using, how they can diversify their diet, because we are consistently having one food, then you're missing out on everything. Just teaching them also that you really don't have to eat one particular meal, like if it's ugali every single day. We can also, bring in green matoke, we can bring in mashed sweet potato, and you're serving it with your chicken and you're serving it, the vegetable, and that is a complete meal. So on my end, I feel they do get challenged on the very, very first consults when I tell them we need to alter what is on your plate. Yeah.
Okay. So people tend to have a challenge with modifying their lifestyles per se.
Yeah.
And how is it dealing with patients? Because I'd imagine as Kenyans, our staple food is ugali na skuma and bas. For some people, that's it. So how do you tend to educate people that you need to incorporate protein or this or that?
So when we look at functionality and the economical perspective of this person, I have to put that in place and work with what do we have in season, where do you live, and what are you able to access. And at times they also acknowledge that they actually didn't know that I have all these options around me. It's only that maybe you've been brought up with that particular meal that is always available, and you also don't want to just look further. It's not that there's really a lack of that particular food. It's just that they were not very keen, or rather they were not open in exploring, into these other foods that are available, or rather how to just combine them. That's what I'm seeing from my end. But it's not like they're not able to access these other foods. It could be cultural, like this is what you are used to, and so you cannot take me out of this.
So I think an example would be, let's say, when it comes to sweet potatoes, ongwashe. We as Kenyans were used to just boiling. That's how we were raised. We only know how to boil. But there are very many ways of cooking this one vegetable, like
Exactly.
baking, air frying, roasting. So I think I understand that we tend to be boxed that I can roast sweet potatoes
Yeah, and serve them with my chicken,
with your chicken.
And also they need to know now, like I mentioned, foods rich in potassium, sweet potato was one of them. When you boil it, because it's a water-soluble mineral, then you lose most
It
of it.
leaches into the water.
Exactly. So you can also alter how you cook your meals.
Okay.
Yeah.
So it's now going through that. And so when it comes to diet with hypertension, the goal is to reduce sodium intake and raise potassium intake.
Yeah.
So increase your avocados, your bananas every day, the sweet potatoes, as you said. So when it comes to sweet potatoes, I'm curious, what would be the best way for me to have sweet potatoes if I have hypertension in terms of trying to increase my potassium intake of the day?
So the best, of course, would be if you have the option of roasting them, you can roast them. If you have the option of air frying or baking them, you can bake them. And also in the process of baking, because you also don't want to have a boring meal, you can add things like the rosemary, you can add garlic into it, and then you be in the essence of using very minimal oil, you can also add a little oil because they are very rich in vitamin A, and which is a fat-soluble vitamin, so you need that as well.
Because I've seen that mistake when it comes to carrots.
Exactly.
We boil carrots, and since it's a fat-soluble vitamin, you can't really ingest
Yeah,
the
so you're
vitamin
just
A.
having your fiber.
Your
and you
fiber,
don't want
and
to
the vitamin A is
maximize.
just coming and going. Okay. I think that was thank you for your insight. That was very insightful when it came to hypertension. I'd like to see if there are any questions from the audience. Let us see. Any question on your end? But in the meantime, I would like to say that having hypertension is not a death sentence. As much as it is a leading cause of mortalities in our country, it doesn't necessarily mean that it is a death sentence. It is more of a wake-up call that we need to take care of ourselves and make sure that we are on top of our health. Because hypertension is only dangerous if we do not watch it.
Exactly. It's not monitored.
As I'm looking at YouTube, I cannot see no questions on that end. Let's check our other platforms. On this side, no questions. On that side, any questions? Age is what's affected by hypertension. When it comes to age, we'll both give our insight. I tend to see mostly above 40. 40 and above tends to, as part of the risk factors of hypertension, one is age. There are many risk factors on hypertension, one being age. So age tends to be above 40, above 50 mostly. But anyone above 40, the older we get, the higher our risk of hypertension. Another risk factor is if you are male, you are of higher risk of getting hypertension than the fairer gender. Another risk factor would be weight, as she mentioned. The heavier you are, the higher you are at risk of hypertension. And another unfortunate risk factor is our race. Africans tend to be of higher risk of getting hypertension than the other races, the Caucasians, and the white people. Africans tend to be of higher risk of getting hypertension, diabetes, and all these chronic illnesses. But age should be above 50. But nowadays, that number keeps coming down, lower and lower. So even there are people in their 20s and 30s getting hypertension. That's to answer that question. Any insight on your end for patients you see?
On my end, I would say let's eat more of our local foods, because I have not seen billboards that are talking about sweet potato, duma. All the billboards I'm seeing are talking about
KFC.
KFC pizza. Let's slow down on that, because it's lifestyle is one of the things that predisposes us to hypertension. Yeah, and that is you buying KFC throughout.
Just
Pizza
thinking you're not
throughout,
sure
yeah.
of lots of sodium.
Yeah, because you can practice nutrition 80%, ensure that you're eating clean. Let me put it that. So that 20%, maybe someone has called you out for a birthday
You
and
can
you really
enjoy
want
those.
to enjoy a cake. Yeah, true.
So we're not demonizing junk food
Yeah.
or the other fried foods that are fun to eat.
Yeah.
We're more of encouraging that you should watch yourself, because everything in moderation, as with anything in life, everything needs to be taken in moderation. But the focus is, when it comes to our diet, focusing on whole unprocessed foods.
True.
So these are foods that have not gone through any processing. So rather than sausages and bacon, it would be better to buy fresh meat from a butchery rather than buying chips from KFC every day. You're better off buying and frying the potatoes yourself, even if you really want to fry the food. Yes?
Yeah, exactly.
Yeah. So,
Moving on from YouTube, does stress or mental health issues cause hypertension?
yes, it does. Yes, it does. Stress is also another risk factor when it comes to hypertension. Because when it comes to stress, when you're under stress, both mental and even physical stress, our body tends to produce a lot more of the stress hormone cortisol and other fight or flight hormones like adrenaline or adrenaline. And these tend to increase your blood pressure. So if you have chronic stress, it tends to now lead into hypertension. So, yeah.
Does family history increase risk?
Yes, family history does affect your risk. It is a risk factor, but it is not an automatic ticket to hypertension. It just means that if my grandfather had it, my father had it, statistically, you are of higher risk than the general population of getting it. There are some genetic links that we've seen between, when it comes to family history and hypertension and diabetes, but it is not concrete enough with the knowledge we have now that these genes cause hypertension. So it's more of a causality that people in your family have had it, you're at higher risk of having it. So you need to watch yourself a little bit more than the general population if you have a family history of hypertension.
What are the warning signs of hypertension?
Early signs,
Warning.
warning signs. As we said, hypertension is silent, very silent. And by the time these warning signs are coming, it could be your pressure is extremely high or the complications have started setting in. So one would be dizziness, very severe headaches that might not even be elevated by you're taking your Panadol, it's not helping. So very severe headaches, blood vision, dizziness, losing consciousness, seizures sometimes. It's very vague symptoms. You can have the chest pain that I was saying, a symptom of heart attack. Those can tend to also be warning signs. So yeah, mostly we tend to see when it comes to the neurological symptoms. So the dizziness, the headaches, those tend to be the more common warning signs. But as we said, it's silent. That's the scary bit.
how much salt is too much?
I will pass that along to her.
All right. So if you're managing hypertension, the recommended will be below 500 mg, 1500 mg, sorry. That is like half a teaspoon actually. Now for the general population, 1 teaspoon should be enough for your whole day. But how will you know that if you're not keen on
Actively.
labels? Because when you look at the sources of sodium, most of them are coming from external than just from the food itself, the food that you're preparing. So you need to add table salt. Or if you're buying processed foods, or if you are buying canned foods, in that order. Yeah.
Is sea salt healthier?
I get that a lot because what they're missing, the reason why we have salt in the market, it's because it is accessible to the general population so that everyone is able to get iodine. So what basically we are getting from something like sea salt is other minerals that may lack from our table salt. But then at the end of the day, we need that iodine from. So I wouldn't say this is better than the other one, but generally everyone has to exercise caution when it comes to using salt. Yeah.
Because at the end of the day, salt is still sodium
Salt,
chloride.
yeah.
But the different types of salts have different concentration of minerals. The table salt that we buy from the stores, it's been iodized. So the government of Kenya and many other governments, to prevent iodine deficiency, they decided to add iodine to our table salt. So you will find that the Himalayan salt, the sea salts, tend to not have iodine. So it's not really a matter of which salt is better. I think it's a matter of, you can have all these different salts, because some of them, if you're into cooking and culinary arts, different types of salt gives ever so slightly different characteristics. So it's not really one's better than the other. Anything aside that is just marketing.
Yeah.
Is there any connection between coffee and hypertension?
Yes, there is a small link to coffee and hypertension, because why we drink coffee is caffeine. Caffeine is the stimulant that is found in coffee and tea, but it is in higher concentrations in coffee. So taking excessive amounts of the stimulant that is caffeine can tend to raise your high blood pressure in some individuals. But it is a good rule of thumb, as we said, everything in moderation. Everything in moderation. But there is a slight link to it, because it is a stimulant. So that's it for this live. Thank you so much for joining. I hope we all learned something about hypertension. Thank you, Christine, for coming and giving us insight. And if you have any questions, require a nutritionist services or a doctor's services, please feel free to call us at 0800 727 95 to be able to speak to a doctor 24/7. We are open 24/7. So even in the middle of the night, you want some medical advice, feel free to call the number that I have mentioned. You might find me. Bye-bye.